I'm Dr. Aleta Bonner. I'm a pediatric emergency medicine physician who also does a lot of point-of-care research, and I work at the Dell Children's Medical Center of Central Texas in Austin, Texas. I specialize in pediatric emergency medicine. I also do a lot of point-of-care testing research in children and adults. I'm here today to help produce a video to help train people how to do correct nasopharyngeal swabs. My expertise in point-of-care testing has had me obtain several thousand of these, so I thought I would help impart a little of that knowledge and expertise to you today. There are two different swabs today that we're going to feature. The first swab, these are both made by COPAN. They are the mini-tipped flocked swabs. You can see that there's a little fine kind of bristly end. I tell people it's kind of analogous to the fuzzy part of a pipe cleaner. Some people don't know what a pipe cleaner is anymore. The top swab has a little thicker, less flexible shaft. The lower swab has a little longer portion of the narrow shaft and is more flexible. I actually prefer the top swab more for collection both in children and adults, all the way from infants through adults, because the top, less flexible area actually lets me have better control of the swab. When I place it in and go under the inferior turbinates, you can actually feel as you do the rotation that you're actually getting better control. Sometimes with this less flexible shaft, especially in littler kids that you're only inserting at a small distance, there's not as much control and you tend to have a little more flex in the swab shaft, causing it not to pick up cells quite as well. So I typically prefer this shaft over the lower one, but both work equally well as far as picking up a sample. One of the things to note when you insert the swab is to go in a horizontal configuration to the patient's head. You can see on this diagram behind me, and I'll use my swab as a pointer, that you're actually going horizontally. You're not going vertically. You don't want to insert this straight up into the nose like you would normally think the nasal passages are going. To get under the inferior turbinates, you're actually going to start at the very base of the nose in this little fleshy area. You're going to go gently over that skin, and you will feel the swab slide right into this area. If you do it correctly like this, the swab slides straight in, is of minimal discomfort to the patient, and they'll feel more of a tickling type sensation, sometimes have just a little bit of tearing in the eye on that side. But this is not painful at all, and you notice that the key is that this swab is horizontal, not vertically tilted as I'm showing here, and that's the key. So I'm going to go through a couple of steps and show you exactly how this is done. I also want to tell you that as far as protective wear and gear, some people will deck out in everything, including a gown, gloves, mask, eye shields. Typically in my setting, the respiratory therapists, techs, doctors, nurses, we all just put on a pair of gloves. If we have concern that the child or adult has a more significant illness, something more contagious like TB, then full precautions with all the body gear would be appropriate. But in the setting where you're going to be doing nasopharyngeal swabs, typically all you need are a pair of gloves. Some people may choose to also put on a little face shield or a mask if they feel like the kid might cough on them and cause them to catch illness, but that's more to protect you than anything. As I told you, I've collected several thousand nasopharyngeal swabs over the past several years doing point-of-care research. So for me, the depth of insertion of a nasopharyngeal or NP swab is fairly intuitive, and I can do it almost with my eyes closed, but I would recommend keeping them open. The depth of insertion is actually easily measured, and there is a handy guide that COPAN supplies where you can look and see the measurement from the earlobe to the base of the nose, right here where the flesh ends, and you would take that measurement and then divide it in two. So if you had 4 inches on the ruler, you would take and actually mark on your swab where 2 inches would be. So in this case, you would mark right about the junction of the thick portion of the swab narrowing down. In the case of the adult, on this particular swab, that works out perfectly almost every time for this junction to be the correct depth of insertion. With a child or an infant, you're going to go a little less deep, so measuring is often very good, especially in the younger kids, so that you don't insert the swab too far. I'm now going to demonstrate inserting the swab correctly on myself, and I'm going to show you how to do it where it causes a patient minimal discomfort and can easily be done in any type of setting. With the swab, you're going to take it and very gently guide it into the nair, and you're going to feel it go just up and over at about this area. You'll feel it just go over that little skin ledge at the bottom of the nose. At that point, you want to take it and go horizontal and just continue to insert until you felt the correct depth. And in this case, I can feel I'm under the inferior turbinates. You can see that this is not a noxious thing. It's not causing me any discomfort. I'm still sitting here fairly casually talking to you and not crying, kicking, or screaming. You then remove the swab, and you should see a nice little coating of mucus on the swab at that point. If you don't, you should take the swab and gently insert it into the second nair. Do the same thing, just repeat the entire process. Once you've gotten your swab out, you can either take it and go directly to point of care testing, or you can take it and put it into transport media. And you will see that there's a nice little reddish pink line right here, which is the guide to break this off into a tube of media. And as I do this on several of the children, you'll see that I will actually break the swab off, and you'll see how easily it snaps off and goes into your tube.